Hi, this is Tyler with Survivalpedia. Today I'm going to talk to you about the Survival MD book, What to Do When There Is No Doctor. The topic we're going to cover is buying or building medical response kits. You can find that on page 69 to 73. So if you look at page 69, it talks about buying medical response kits. It talks about how to build a response pack for superficial wounds and kits for wounds requiring sutures, staples, and so forth. So the way I like to look at medical response kits is purpose-built and also task-oriented. What I mean by that is if I'm going hiking, I'm not going to carry this, right? This is something that can stay in my car. So the purpose would be hiking. The task would be splinters, lacerations that are small, cuts, possibly broken bones. And you need to account for that if you're going to be multiple days in the backcountry. You need a way to deal with it. Be that a natural remedy, like taking a stick, wrapping t-shirts around it and using that as a splint, or bringing a SAM splint along with you to deal with broken bones. So identify the purpose, identify the task, make sure it's appropriate for the situation. In the military, we have this thing called an IFAK. It's an improved first aid kit. And essentially it has bullet wound or bullet stopping equipment. Primarily, it's going to have one or multiple tourniquets on top of it, like I do right here, because when you need a tourniquet, you need it now, and it's usually something you need first. Bleeding can kill you faster than not being able to breathe, so it's even more important than airway. Having said that, we also have sucking chest wound kits that work like a valve to allow air to escape the chest cavity and then compress to allow the negative pressure to inflate the lungs. We have oral and nasal pharyngeals, and they're essentially a device to hold your tongue down or a device to go into your nose. That's the length of your nose to your ear and give you the ability to breathe if you're knocked out, incapacitated, whatever happens to you. And we have tons of gauze for packing wounds and body substance isolation. Now in the military, body substance isolation isn't as big of a deal because you're dealing with soldiers for the most part. But whenever you're dealing with the general public or people that are unknown that might have biological contaminants, body substance isolation is the number one thing you need to deal with. If you are hurt, you can't help anyone. So what is BSI? BSI is rubber gloves, mask, eye protection, anything that can prevent splash or contaminants or viruses or spit or blood or whatever from getting into cuts, getting into your eyes, your mucous membranes, anything like that. Alcohol or some sort of antimicrobial, antibacterial to clean up the aftermath is also as important. So let me cover the basics of this medical kit real quick. Some of my quick access items are tourniquets. I have those right up front, and airway, because those are the two things that will kill you the fastest. If you have a massive bleed out, tourniquet is one of the best ways to stop that bleed out on the extremities. Wound packing is the next level of that. And then some around that phase is going to be air. So airway, I have a mask. Again, this is body substance isolation. This mask goes over someone that's incapacitated. I can breathe in it. I don't have to worry about vomit coming back into my mouth, which often happens when you have people that you're doing CPR on. You'll compress the stomach and water will come out, vomit, asphyxiation, whatever. And this mask will prevent it. And right up front, we have gloves as well. I have a multitude of gloves throughout this pack, so almost every pocket I go to, I will have access to body substance isolation. Now, earlier I talked about levels. The lowest level, you need Band-Aid for your kids. You need Neosporin, ibuprofen, Benadryl, those type of things. I have those right here close, but it's a little bit deeper because I may not need them as fast and I can afford to dig and get to them. Like I said earlier, I've got gloves in a multitude of locations. I've got scissors. I actually moved this to a lower level. It should be up here. I've got burn stopping. I've got stuff to take particulates out of people's eyes. I've got the bandages that I talked about earlier. So if you have a bullet or a gunshot wound and it creates a wound cavity on the inside, the first thing you need to do is to stop the bleed, right? And you can't put a tourniquet on a dorsal area. So what you'll do is you will pack the inside of that wound cavity with gauze. If you have something that's hemostatic, meaning chemically stops blood, you put that in first, and then you load up the gauze afterward, and then you add pressure. If you can stop the bleed, then surgery, you can correct it after that. If it's in an extremity or an arms or legs, basically, you can use the tourniquet, and if one doesn't work, throw another one on. So if you only have one, you can only use one, which means grab more than one. The next level that I have right here is burns. One of the things that I really like for burns is Burn Free. It's a brand that we have that I've used for sunburns multiple times because, you know, gringo. And having quick access to that can substantially decrease the repair or rejuvenate time after a burn. This is a burn mask, and essentially if something blows up in your face, like a fire or whatever it is, I don't know, maybe you're trying to get your barbecue to work and you blow the skin off your face, this mask will be able to cover all of that and immediately start pulling the heat out. Don't use stuff like butter. It tends to keep the burning process in, and you want to pull that out, not put it in. So burns are something to deal with. Right here I have Purell. That's that body substance isolation correction stuff. And then as we get deeper, so to back it up a little bit, I had Stop the Bleed Airway, Broken Bones, because it's kind of large and awkward, Burns and Eyes, wound packing, wound channel correction. There's another tourniquet here with body substance isolation on the top. And now we get into the more complicated stuff that may not need quick access, like moleskin for blisters, Band-Aids. When you pack Band-Aids, grab the big knee Band-Aids, because if you really need a Band-Aid, and it's not just a little cut, it's probably a decent sized cut, and you're gonna need the larger knee Band-Aids. Medication is inside of there. And then some more complicated solutions like sterile solution to rinse eyes and rinse wounds and those kind of things. So that's my build out on that. If we go back to the book, he kind of gives you a basic guideline and allows you to use a little bit of your knowledge to go in depth on your own. They have for fever, it talks about fever, pain. There's different herbal medicines that we have. I jumped forward a page here. Betadine swabs, Band-Aids, paper tape, using medical response kits for wounds requiring sutures or staples. That's something that you're going to have to rebuild or reattach skin and so forth. Now with that, you also are going to have some sort of antimicrobial, antibiotic that you're going to have to get some deeper knowledge on. Response packs for complicated wounds and fractures. He goes into depth, and if you go later on in the book, there are sections on types of skin sutures, which is phenomenal, the tools that you'll need, how to stop the bleeding, which is extremely important as well. And it even goes into depth on the different types of fractures, the way to set them, and how to deal with all that kind of stuff. So, if you're interested in this, it's called Survival MD, what to do when there is no doctor. Thank you for watching.